Hello everyone, welcome to Dr. Chan's Minor Ailments Forum, and I must say this is my debut show, so thank you very much for tuning in. So you might actually ask, what is this show all about? Well, basically I would like to spend 10 to 15 minutes talking about some interesting medical facts, or maybe some hot topics that's on newspaper, or even some minor ailments that we kind of encounter all the time in the GP practice, but we don't have enough time to explain to you what they're all about. Now, let me ask you, when you go and see a doctor, do you not feel that we're really rushed sometimes, and you feel like, I want to ask a question, but by the time you walk out of the door, you either forgot about it or you never actually had a chance to ask about it? So I thought the only way for us to look after ourselves properly, we need to know what to look out for. So I'm spending a little bit of time with you every week just to go through some common medical problems, so we can actually look out for the symptoms and present to your doctor at a timely fashion in order to reduce complications. So normally I would invite the listeners to phone in to maybe ask a question, or even calling in for some suggestion of topics that we can talk about. But obviously this is our first show, so I've just chosen quite a common topic to talk about this time round, which is depression. Now, when you hear this word, you probably think, so grim. Yes, it is very grim, but once again, this is a very common problem in our society. It's just because we are working all the time, it's hard to earn money, even hard to get a job. So, people are working very hard every day, and people, will encounter problems at work, maybe even in relationship, and they feel low. Now, but depression on its own, as a terminology, does not mean that you're feeling depressed only. Okay, for example, you might say, I really want to pass my exam, but somehow I failed, so I feel really depressed. Yes, you feel depressed, you feel low, but that doesn't mean that you've got depression. Depression is actually a collection of symptoms. So it's, apart from feeling depressed or low or no mood to do anything, there are other things to look out for. And I think that's quite a misnomer in the community. People think, depression means you're feeling depressed only, and I must say it's not just that. Sometimes people don't even know they're depressed until they come and see a doctor. They might present with feeling tired all the time, or they used to do a lot of hobbies and they do enjoy it, and now they don't feel like doing anything at all. They don't get dressed, they don't wash themselves, they just basically cannot be bothered to do anything. Some people might say, I haven't been eating anything at all. I don't feel like eating. I lost my appetite. In fact, I sleep all day. I go to bed at 8 o'clock. I get up at 10 in the morning, sleep through the whole night, but I still feel very tired. Now, these could be signs of other problems, of course, like, for example, some people who've got diabetes or low thyroid. They sometimes present like that too. But, if you excluded everything biologically, then you might have to think about whether these symptoms adding up together, could they be contributed to depression. Of course, the most common symptoms of depression, apart from feeling low, they also feel very tearful. And they said, I'm normally quite a cheerful person, but don't know why for the past few months I've been very tearful for no reason whatsoever. In fact, my life is actually quite good. If I step back and have a look, I've got a good job, I'm not stressed, I've got a really good family, supportive family, but I just feel like crying all the time. And I think if these symptoms that I mentioned about, happen to you, or you notice your friends got these kind of symptoms, I think that would be an alarm bell for you to kind of think, yep, it's time to go and see a doctor and see what's going on. How do we as doctors actually diagnose depression? Of course, we listen to you and see, what the history was and how long has it been going on for, what has been happening to you. We put all in all together to see, could you be having depression? And secondly, we normally do a questionnaire, and it is called a PHQ-9 questionnaire. And you can actually look it up online. I think that's quite important or quite interesting for you to do as an exercise. Go and look up this questionnaire, which is called PHQ-9, and you go and do the questionnaire. There are 9 questions, and they're there to reflect how you've been feeling in the past 2 weeks only. So we're not looking back too far back. We're only looking for the past 2 weeks of your mood and how you've been feeling. So the maximum score of this questionnaire is 27 points. So as you can see, the more points that you score, the more likely that you are suffering from depression. So now, let's just say a diagnosis of depression made. Then what do we do from there? Now, most people would have a thought, saying, actually, I don't really want to take antidepressants. I don't really like the name of it, because what if my friends found out I'm taking antidepressants? They might laugh at me. They might say, oh, well, just get yourself together. You don't need medication for that, and so on and so forth. Now, I always explain it to the patients that come in to see me with depression when they come to the question of whether you need to take a medication or not. I would say, well, it all depends on the circumstances. Well, let's just say that if the depression is related to some events, for example, a bereavement, or maybe a breakup of a relationship, or maybe losing a job. Well, this is a reactive depression, because probably beforehand you were feeling absolutely fine, and these events happened and that made you feeling low. And that, generally speaking, you might not need to take an antidepressant for that. But obviously, a very severe reactive depression, you would need antidepressant too. Now, in some cases, that, for example, a person came in with a very strong family history of depression, and they've also been feeling depressed on and off throughout their life. In these circumstances, it's likely that the depression is caused by a chemical imbalance, for example, low in serotonin. So in that case, you probably will need to take an antidepressant to replace the chemical that you're either not generating or not enough. So it's the same as, people who are anemic and they need to take an iron tablet. And it's probably the same as someone who's depressed due to a lack of chemical that we need to replace it. Now, of course, you need to bear in mind that the antidepressant is not a magic pill, so you shouldn't kind of see it as a course of antibiotic. For example, you take it for, 3 times a day for 7 days, and then you're better. It's not like that. So most people who are started on antidepressant tend to need to take the medication for at least several months on a regular review, and maybe years, depends on how they're doing. And let's just say if they're absolutely fine and completely stable, or the event that made them depressed had actually moved on and sorted, then they might be able to come off the medication. So apart from taking a tablet, there are also other things that we can use to help with people who's got depression to get out of that situation, or at least learn how to deal with the situation a bit better. So I don't know whether you have heard about CBT, for example, which is cognitive behavioral therapy. So the cognitive part of this therapy is to, by understanding what the person has gone through, how were they brought up, what kind of things have happened to them, that might be the trigger of their depression. And the behavioral part of the therapy would be, now we know what was the trigger of, or the triggers of the depression. Now we can use some therapy to teach the person to deal with this situation better. And I must say, from studies and also from day-to-day experience, like by seeing my patients, CBT really helps them to improve on their self-confidence, remove their anxiety, and also help them to deal with the depression a lot better than without the therapy. But I always tell my patients who are planning to go for CBT 2 main things really. One, it is not easy. Most people think that if they go for therapy, it's the same as going to counseling and they feel better straight away after they came out from the therapy room. No, it's not. And in fact, most people who go through therapy find it really difficult at the beginning, because they probably have been hiding something or some secret inside their head for a long, long time. They're trying to bury it under the bed or under the sofa for years. And now the therapist is starting to question them to see what could be the possible triggers for their depression or anxiety, and that sometimes can be quite hard for the patient to take in, really. But once you go in with the proper mentality, and you know that it's going to be difficult at the beginning, and you bear with it, then in time you realize the benefit of CBT. And the number 2 things that we need to bear in mind is that if you go into the therapy thinking, oh, I don't really believe in this kind of thing, and then it will never work for you, because you have to put in 110%, if not more, in order to get your mind into the right mode and to benefit the most from the therapy. Now, there's no fixed time of how long someone's going to be depressed for or have a depressive disorder for. It all depends on the circumstances, the patient's resilience, and also the support from the friends and family. So, I would say the first thing first that you need to do is, if you think that you're suffering from depression, or you think that someone around you might be suffering from depression, it's very important to provide a support and point them to the right direction. And the first port of call would be to go and talk to your GP about your problems and see what we can provide for you and to support you in the community. Because depression is a very, very common condition. And there are a lot of supports out there. You just have to reach out and say, I need some help right now. So I hope that you found the above information useful for you. And I'll be more than happy for our audience to either write in or to contact the radio station of a topic that you would like us to discuss next time. Well, until then, have a very good day. Bye-bye.